In terms of enrolment by region, 280 across Europe, 120 or so in North America, and a smattering of individuals from Latin America and the Asia-Pacific region. This looks at patients per country, so the United States, 25% of the patients, UK, 11%, Netherlands, 12%, Germany, 15%. Just to give you a sense of the number of countries involved and how we're creating this, part of the value of the registry program is not just to be a database, but it's about creating a global community of individuals affected by the condition. Okay, I'll share some of the demographic information. Demography means patient characteristics. So the slides are quite busy, and I kept them purposefully busy because I know in the audience we have both highly scientific doctors and nurses, but also individuals who aren't medically trained. So I wanted the data to be here so some people can see them, but I've highlighted certain things that I'll bring out that I hope you'll be able to see. If we look at the first line, we've got age of diagnosis, and of the 328 individuals who either answered this question or that we have data on globally, the average age of diagnosis was 33. Okay. We can compare that to the UK patients on their own, of which there were 41, and the mean age was 38. Age of diagnosis. Okay. To give you another example, if you look at the time from diagnosis to first infusion, globally we have information on 174 individuals, and the time from diagnosis to first infusion, the mean time was 8 years. Okay. And in the UK, of the 33 patients that we have that information on, 7.5 years. Okay. Now hopefully when we cut the data grid next year or the year after, these values will become less. Hopefully we'd see earlier and earlier diagnosis, and hopefully we'd see a shorter time between diagnosis and treatment. So this was some of the information on age of diagnosis, symptom onset, and as the comment has already been made, hopefully that will change as time goes forward. This looks at groupings of patients. So in the UK, when we ran this data cut, you can see that there were 9 individuals between the ages of 18 and 40, 18 individuals between the ages of 40 and 60, and 9 between the greater than 60. And that's mirrored also by the percentages in what's happening across the world. The male-female split in the UK is 25 males to 16 females. What about signs and symptoms? That's some of the demography. What about signs and symptoms? Well, once again, I'll just pick a few salient features on the slide. If you look at the group greater than 18 years, of which there were 259 individuals who we captured information on, the commonest symptom was, which 81% had, was muscle weakness in the lower extremities. Okay. The second commonest, 71%, muscle weakness in the upper extremities. The third commonest symptom, 61%, shortness of breath after exercise. So we're starting to build up a picture of the kinds of symptomatology that different age groupings and different individuals have with the condition.